The Robert Wood Johnson demonstrations really introduced the whole notion of self-determination to a lot of people. Unfortunately, it wasn't a lot of money, so it really depended on how fertile the ground was, and whether there was significant state leadership as to whether or not it really took hold and blossomed. We were one of the evaluators of those demonstrations. And many of the constraints that we identified then, many of the problems and many of the sort of exhortations are as current today as they were 15 years ago, as were the comments of people with disabilities who were in those programs. I'm on the advisory board for the Real Lives legislation in Massachusetts, and one of our self-advocates on the board talked about, and this is a couple weeks ago, his experience and the experience of his colleagues about trying to self-determine and the barriers put up by case managers, people not taking them seriously, talking to their families instead of them. I mean, it was as though, 15 years hadn't passed. So, though it certainly lit a fire, it's not a fire that's taken, that's a bad metaphor, but it has, those seeds have not fallen on fertile ground in many states. That's not true in every state. And I think, you've still got enormous power in providers, a lot of fear among families. So I was talking with a colleague actually today, and he basically said to me, deinstitutionalization was a big deal, and getting all those people out of facilities, and he'd done a lot of that. He said, but this is harder. The self-direction is harder to do, because it really takes turning the system upside down and disaggregating it in ways that are very hard to do with all the vested interests. I mean, deinstitutionalization was tough. There were a lot of barriers, but you were building something as opposed to deconstructing something. Yeah, National Core Indicators, which started really back in '97, which is a collaboration between Human Services Research Institute and National Association of State Directors of Developmental Disability Services, really was developed to fill a vacuum. I mean, at that point, quality performance measurement systems were really looking at inputs and processes, and there was very little data about whether or not what we were doing was really having an impact on the quality of people's lives. I mean, obviously there were people thinking about the quality of life movement, certainly here in Canada, and our good friend Bob Schlock were beginning to design instruments. But there was nothing sort of at the policy level. So a group of states got together in the late 90s to talk about how would you know the system was working? What data would tell you whether or not you're living up to the promise that you're making to people you're serving. And so through a process that went on for several months, working with that group, coming up with domains and then specific measurements that are now part of the National Core Indicators consumer survey as well as family surveys. I think at first states weren't entirely sure what to do with it because they hadn't had this kind of information before. But now we have 42 states, all of the regional centers in California, and in the 14-15 data collection cycle, we'll have 20,000 individuals represented, which I think at this point is the biggest database on people with intellectual disabilities in the world, as far as I know. And as the autism diagnosis increases, it also is becoming a rich source of information about people with autism. But it's measuring many of the things that are part of the self-determination, individual empowerment movement. Are you making choices in a whole variety of ways? Do you have access to your community? Do you have relationships? Are you able to date? Do you have privacy? Do you choose who you live with? So it's all the sort of hallmarks that we've all talked about for years as to what should happen to people who are self-determining. And many states have used it to do a variety of things, whether it's looking at an extraordinarily high proportion of people on psychotropic medications. What do you do about that? People who say they're not included in their planning process. States have taken initiatives around that. States have built whole, system reform efforts around some of the data that they're finding. The extraordinary thing is that in order to be an NCI, you have to agree to make your data public. So it's a totally transparent thing, which I'm constantly amazed really happened, because states, public managers are a little nervous about comparing themselves to one another. But I think it's been incredibly healthy. And nobody's great at everything. Some people are better at some things than others. So I think it's a very important way of really seeing whether these values are being carried out in practice. And I think what we know so far is that the people who are able to take advantage of this option are people with milder disabilities. I mean, when we parse our data, who's self-determining? Not people with serious and profound disabilities. There also are not very many people self-determining. I had the staff do a graph, I think it was over 4 or 5 years. Even though it had ticked up a little bit, it's at 8%. That's, for a system as big as the one we've got, that's still a small number of people. So we have a lot of work to do.